manager in Los Angeles, and he is going to be presenting for us today. So, Marcus, I'm going to turn it over to you. And did someone start the recording already? Oh, yes, they did. All righty. So, we're ready to go.
Awesome. Thank you, Janella. As I already put in the chat, I absolutely love having the opportunity to work and serve in the Pacific Division. I've worked with a lot of you guys on different DROs. And I've also had the opportunity to work with you in Blue Sky, serve on lots of different things with you. I'm really just excited to have you all on the call today and to be a part of this. When Susan approached me about discussing staff services and where we might do something, I was really excited because I think anyone who's met me knows that I have a serious passion for our volunteers and a serious passion for the role that staff services plays. I think that it is often underappreciated and often not understood in what we do. So I was really excited to be able to come and chat with you guys a little bit. I'm gonna put a disclaimer out there. I'm not the expert. Just because I say this does not mean that this is the way it is. Some of the things that we're going to talk about today are things that maybe have been done on different DROs or that I've experienced in the Los Angeles region, or I've talked with some of you guys on this call specifically about how we do things and how we stand up. I'm not the expert. Doesn't mean it's right. This is just some things for us to think about and consider. Um, as you can see on the slide, and I'm going to do my best not to over talk on things that maybe were already covered under the fantastic and fabulous Peggy Pinabarsi, who's our NCCR DWM, who did the first 24 hours and what you expect. So there may be a little crossover, but we're going to talk about them hopefully in a little bit of a different light. I'm not going to go into all of the specifics on specifically how to click the buttons because there are 100 million fantastic job tools and videos to do that. We're gonna talk a little bit of a high level overview, and we're gonna talk a little bit on strategy and thought processes around a DRO in your local region that is becoming a little bit more. It's becoming something that now we know we're going to need a little bit more. So, all right, let me see if I am smart enough to work slides and talk at the same time, because you never know. All right, so we've got a DRO number. You are probably already doing something very regionally managed. You probably are using an Excel spreadsheet or a shift tool or really old school Post-it notes. You never know. You're probably doing a little bit of all of that. And now this is a little bigger. A DRO number has been requested from your planning team to the division through DSARS, and you're getting one back. So now what do we do in staffing? The first thing that we do is set the DRO up, right? A lot of people think magically we've got a number from DSARS and everything is good to go, then everything is great. Well, there's a lot of work that your teams actually have to do in the background to be ready to move from into a level 2 and above DR. You've got to set it up in VCN first and foremost. the number one thing that you need to start doing at the very beginning is set up your locations. As you can see on the screen, a screenshot from disaster management. Go in and search and see if the locations are actually there before you actually add something to the incident listing. It is always, I included the term search before you leap instead of look before you leap. It could search for it in three different ways of saying it, with a hyphen, without a hyphen, everything you could ever imagine. Try to search it in volunteer connection in that incident listing or location manager prior to just adding a new location. We have found it in the Los Angeles region that surprisingly most of our locations already exist. We have an open operation right now. You can see on the screen that, in May, we found locations that were actually already in there because we'd used them as a shelter site before, or evac center, or something of that nature. So always look and see if you can find the location before you add one. The second thing is, and this is going to save you later, and you'll hear about this a little bit later when we talk. If the location is an older location, there is a magic button in there, and I call it magic, but it's geocode the location. Every location that you have in there, you want geocoded, and that is because the location, when we start setting up DRO shift tools and working with DEBVs and all of those different types of things, if the location is geocoded, it works with the system much better. So even if it's in there, you may still want to go in and edit it and then geocode that location. So that's a really important thing to remember, because it will come up later. All right. After you set up the DRO, the main thing for you guys is then to start assigning your workforce. Start moving from that LCV shift tool DAT model into more of a confined space and a space where we're actually assigning workers. We're asking workers to give us 2 weeks of time, or a week, or 5 days, or whatever we can do. Absolutely, what you want to start doing is first get your supervisors assigned. Yeah, and I see you guys correcting me on my, not correcting me, but helping me out with my wonderful acronyms. So I really appreciate that. It's just the way we talk, unfortunately. But so you want to start assigning people. You want to get your operations management staff assigned. You want to get yourself assigned and your staffing team. Always think about the staffing team first and foremost. This is the one time that staffing gets to be a little selfish, is that always think about your team and what you need. How many people do you need? Get it assigned early, get them on the operation, and get them access. In the Pacific Division, we use sort of a 3-day rule. I think National tends to use a week rule. If they're going to be working 3 consecutive shifts, we assign them to the operation so that they can get an eval and so that it's on their record. That's not a hard and fast rule, and you'll hear a lot of things that I'm talking about that are not hard and fast rules. These are guidelines. These are suggested practices. Once you start getting the people you know are going to be working and assigning them, you really want to make sure that you notify those responders before you click the assignment button. It can cause some confusion if you're not reaching out to them and letting them know that you're going to be doing the official assignment in volunteer connection. And the reason behind that is because they're going to get automatic emails for assignment. They're going to a lot of things. If they're in person, you may have already done some sort of regional version of a pre-assignment health questionnaire, maybe a DAT wellness agreement or something of that nature. At this point, they're going to have to do the official national pre-assignment health questionnaire. Once you hit the assign button, it will immediately trigger a text and email to them so that they get the ability to go in and do that pre-assignment health questionnaire, or PAHQ, PAHQ. So let them know that that's coming, because it is a very finite window that they have to fill that out. So you don't want to do it overnight. I know a lot of times on disaster staff services, we come in at the beginning, and then 9 or 10 p.m. at night, we're trying to catch up on admin work. You need to be aware that when you're assigning people, you can't do it at 10, 11, 12, 1 a.m. when you're catching up on that admin work, because they actually have to go in and they only have an hour to take that PAHQ. So that's something that you want to remember. We do a lot of the behind the scenes work, and we want to make sure that that it's, you got to do it where they can respond to it for the PAHQ. All right. Once you have everyone assigned, one of the first things that I do when I walk into an operation, whether I am taking over from a DAT call or being assigned as an AD of workforce or a simple SPSSA, is that I ask, what does the IPT look like? And IPT stands for Initial Planning Tool. What are they estimating this DRO to look like? Where is it going? Are we looking at a 2, a 3, a 4? And this comes from understanding what the DRO is going to look like and what you might need later to provide that better anticipatory customer service. So if you have an understanding that they're estimating 100 cases, or maybe they're estimating 5 cases, or 2,000 cases, who knows? If you understand sort of what the leadership is thinking the direction of the DRO will go as a staff services unit, you'll be better able to respond. You'll understand whether you need lodging or whether you're going to need to, as the slide says, discuss mission cards, right? If you're going into a 2, 3, 4 level DRO, which is all based on the amount of money spent, you're going to need to think about mission cards. You're going to need to think about whether you have them in the area that's affected, or what kind of distributors you have in your region. While that is a blue sky activity of DWE and the deployment team as staff services assigned to an operation, you may or may not know that, right? A lot of you guys play double duty. A lot of you are on deployment teams as well as being on staff services, but you do need to know what are the resources in your region and in that specific territory that's affected. Make sure that mission cards available. Make sure that whatever the system is in that region, that you understand it and can get mission cards. You have 2 types of mission cards. The maximum daily allowance is the first type of mission card, which is that standard 450 load, $35 a day for 2 weeks, and that's how it's figured. Or the M&T card, which is meals and transportation. And that's the 150 load that is really designed around a lunch and mileage to and from. So talk with your leadership, talk with your region, understand where it's going and how you can better respond and what resources you need available. All right. The next thing I do in that first 24-ish hours is I talk to my job director or operations management team, realistically, That early on, you're probably talking to an OM team that's still a little scattered. And I talk to them about staff requests. You know, a lot of times in the first 24 hours before we have a DRO number, we're working off of assumptions. We're working off of the number of shelters and the standard staffing pattern. At some point, you sort of have to transition from assumptions and standards into requests, where that is the team telling you what they need and how you can assist them in providing them with the appropriate staff that they need. So I always talk to the job director and the operations AD to find out who's approving staff, who's approved to approve staff requests, where they need to come from, establishing which email that they go to, how that gets processed. Every DR is different. Some DRs at the very early stages, job directors want to see every single staff request that comes through. Other DRs, the job director wants to be CC'd on. And then also, sometimes the job director is like, absolutely not. I trust the ADs we've assigned. They can absolutely approve anything. And that's good. You just need to know, as the staffing person, who is the responsible party for approving said staff requests. Once they're approved, we enter them in the system. We recruit either locally via local volunteers, or then we start talking about capacity and what's available to move beyond that. Sort of the next thing that I do in that first 24 hours is, if I'm coming on as staff services, I start engaging and recruiting local volunteers. Every single region has their own system, their own fancy little app or website or MailChimp or whatever they're going to use. But you want to understand and know what systems are used in your local region to start that recruitment and engagement of your local volunteers. Don't be afraid to reach out to DPMs or your local DWE manager. They're probably, hopefully, supporting you as an operation gets set up. And their job is to really make those connections for you as a staff services team. Their job as DWE manager is to make that connection and ensure that you have the right tools accessible to you. In the Los Angeles region, we use text and email pretty heavily. We have a texting system that we use. Feel free to ask your region if there is something like that available for you to do recruitment and engagement of local volunteers. Is there a Google Voice number? Is there a one call or an alert media or 100 other different systems that are used? One of the other things that you can do is posting a banner on Volunteer Connection and getting it out there in front of other individuals instead of just emails where they can click and sign up. Also, consider thinking about other lines of service. Can you recruit from available biomed volunteers or SAF volunteers or even board of directors? Really think about other lines of service outside of disaster when you're standing up an operation of any sort of significant magnitude. You're also going to want to consider training. What orientation do you need to do? And then also, what other trainings maybe that you might want to offer? Is this, you can offer a operational training of shelter fundamentals to get biomed volunteers into shelter shifts. So really think about that in staffing and figure out where you kind of want to go. This is all sort of nebulous, but these are the things you need to be thinking about as you set this operation up. The next step I normally do, and honestly, I can not stress this enough. Engage your local regional volunteer services team. Send out an email to the RVSO, send out an email to your senior engagement specialist, ensure that they know what's going on, have a conversation with them, discuss what kinds of needs this operation will have, discuss what sort of support might be available from that regional volunteer services team. And then I'm just going to tell you, put the bug in their ear pretty early about what it might look like if we have to activate the DEBV portal. The Pacific Division is really pushing to do very early activation of the DEBV portal, and that's disaster event-based volunteers. Most of you, I think, know DEBVs are volunteers, except they go through a different type of background check and have to be converted into general volunteers at the end. And that there are some constraints on what they can do. They can do sheltering, and they can do logistics, and they can do a lot of different things. But there are very defined roles that they can do. They're not generally going to come in and be your external relations person. They're not generally going to come in and be your reunification person, because those are very specialized skills. But if we're talking about task-based work and we can force multiply our trained volunteers, DEBVs are a great way to do that. So I really suggest that right out of the bat, you've got a DRO number, you've got it set up, start talking to your regional volunteer services team and say, okay, are you monitoring intake? And if we want to open the DEBV portal, who is the point of contact that I call in this region to get it activated? Most regions, that's your regional volunteer services officer, or RVSO. Other regions, it may not be the case. They may have delegated that responsibility to the senior engagement specialist. So that's why I'm suggesting right out of the bat, you have a conversation about where we're going with the operation, what we're thinking, the possibility of DEBVs, and what kind of support you can get from that department. All right. After you've done that, and I think I've preached enough on that. After you've done that, you need to consider lodging. I'm very lucky to live in the Los Angeles region, and the Los Angeles region is not very big to drive from end to end. It's only about 60 miles to drive from one end to the other end, but we do have 12 million people in those 60 square miles. So we're a little bit of an odd region, but one of the things that you will need to start thinking about is, are you going to need to house your workers? They need to be within about an hour and a half driving distance of wherever their reporting location is. Carl, Nina, and Michael are our main, that's Carl Gingrich, Nina Napolitano, and Michael Zunkuft. They are #1 lodging folks for National. They are your friends. They'll probably reach out to you the minute that you get a DRO number assigned to you. But if they don't, those are the 3 people that you can go to, or disaster.staffing. We all love that dot staffing versus the other one. Consider if you need it. Consider standing up a virtual lodging team, which is what the VLT stands for, virtual lodging team. If you don't have the capacity in your local region, don't be afraid to rely on the national resource of the virtual lodging team. You also want to make sure that your operations management team, your job director, when they're talking about IPT, STP, initial planning tool, service delivery plan, the next 5 days out, that they are aware that you're going to need to lodge workers, because that really affects the budget. I think not everyone, but some of you may have heard on the call recently from Brad that we're moving and continuing along the lines of housing people individually in hotel rooms as opposed to going back to shared rooms. That may be becoming the new norm. So you'll want to make sure that your team is aware of that, because that could very much so skew the numbers. That could skew the budget and the cost of your operation. One of the most expensive things on any operation is workforce cost. How much it costs to fly them there, house them, take care of them. So you want to make sure that your team is aware of what those costs look like. So make sure that you talk to that very early on with your OEM or operations management team.
Marcus, I want to interrupt you real quickly. How do you want to handle questions that pop up in the chat?
Yeah, Janella, I am happy to stop at any point. If you just want to interrupt me, I don't mind it.
Okay.
If you want to wait to an end, I'm totally okay with that.
Well, I thought that we do have a question from Sherry Curtis that is appropriate for when you were talking about the DEBVs and the when at that time. So her question has to do with at what level disaster relief operation will the DEBV or disaster based volunteer portal be opened?
So Sherry, that's a good question. And the answer to that is that there's no specific, if it is a level 2, it's opened, or if it's a level 3, it's open, or if it's a 4, it's automatically open. The conversations around the DEBV portal is truly that, Sherry. It's a conversation between the operation, disaster workforce engagement, and volunteer services. So there's not an exact trigger. It can be opened on a level 3 or above upon request. So if you are having the conversation with your regional volunteer services team and they've seen a giant, you've got a level 3, they've seen a giant or significant increase in the number of people coming in through the application or what they call the intake queue. That would be something that they would alert to you that we've got a significant number of people coming in and we should consider opening this portal. And it would be a conversation. There's no exact trigger. Did that answer your question, Sherry?
It did. Thank you very much.
Okay, no problem. All right. The other thing, and Janella, was that it on the chat questions, or did you have another one that you wanted me to address?
No, that's it on the chat questions. And we do have some very quick typing volunteers that are taking care of all of the acronyms. So thank you very much in regard to that. So continue on.
Awesome. I love this team. They're great.
They are. Yes, they are.
So one of the other things, after we engage our regional volunteer services team, and we have assigned people to the operation, one of the things that you're going to want to keep in the back of your mind is that the operation probably started 24 to 48 hours before you actually get your DRO number. And you will want to go back in and do the backdated entry into Volunteer Connection. Now, this tool is not necessarily our nicest friend. It does take a little understanding. The person has to have been assigned to the operation and be out processed, which is the O/P, prior to you doing a backdated entry. So you'll want to remember that. Keep a magic little notation or sticky notes or Excel spreadsheet, whatever you use. The important part is that you do want to do that backdated entry so that our volunteers get the full amount of time and they get the credit and the recognition for being assigned to the operation for the number of days that they are. I can tell you, volunteers and our workforce really appreciate it when you go back in and do that and take account of the fact that they were there for 5 days instead of the 1 day by the time you got the DRO number. It does mean something, and it is a great way to ensure that you're really doing that customer service for those wonderful volunteers and workforce that are assigned to the DRO. All right. Now I'm going to talk a little bit more in depth about DEBVs and the DRO shift tool. A couple of things is the minute that you can start thinking about it and start talking about it with your regional volunteer services teams, the activity leads, the job director, anyone who will listen to you, start talking about it literally from the beginning. So have we thought about DEBVs? Where are we at? What is the intake number? How many people do we have in the intake queue? Start talking about it at the very beginning. And the reason behind this is so that 3 or 4 days in, you're not trying to scramble and catch up and think about it later. You're not trying to socialize it later in the discussion. Start talking about it at the very beginning. You'll want to, when you're having that discussion with your regional volunteer services team, talk to them about who is monitoring the intake queue and what those numbers look like. Do you normally get 20 a month and now you have 20 in a day? Okay, that's something we need to think about. Also, talk about what that threshold is. We use a monitoring document in the Los Angeles region that has a couple of check boxes and some numbers that I'm happy to share with you all, that you can possibly even go and discuss with your regional volunteer services team about adapting to a strategy. But we use a very specific monitoring document that says, if this happens, do this. If this happens, do this. If this happens, do this. This happens, open the portal. And so you want to talk about it. You want to talk about what is that trigger for your region in shifting to incoming volunteers being disaster event-based volunteers. And like I said earlier in discussing Sherry's question, it is a discussion. There is no specific guideline from national or from staff services or from the fantastic team of Roxy, Nina, and Paul. There's no specific number. It is a discussion with your region and your team. I always set up the DRO shift tool pretty much immediately. The discussion is the DEBV portal open, and is the DRO shift tool up? And if it's not up, how quick can we get it set up? We want to do the shift tool at the beginning so that it's socialized. You're going to have a lot of local people that are available and willing to help, but not available to do a 2-week assignment, or maybe not even available to do 3 or 4 or 5 plus days. You're going to want to think about allowing the opportunity for folks to continue in a shift-based model for supporting the teams. So you're going to want to set up that DRO shift tool. The DRO shift tool has some limitations, meaning it's a 50-mile radius, and that's something you need to keep in the back of your mind when you're working with the DRO shift tool. If you're posting that shelter is at location Y and volunteer is 60, 70, 80 miles away, they're not going to be able to see those shifts available to sign up. You can still manually register them. You'll also want to ensure that when you set up the DRO shift tool, that you're opening it for all employees, all volunteers, all AmeriCorps, general partner members, and DEBVs. A lot of people, when they set up this shift tool, just click on the DEBV access group to get it set up, but you want to open it up to your local volunteers who may not be able to be assigned and can do shift work. We've been really, go ahead.
I'm sorry, I never know when to break in. Can you use the DRO shift tool when the EBV portal is not open?
Yes, absolutely. And that's why I talk about, thanks Janella for breaking. That's a good place to actually ask that. The DRO shift tool, while most people think about it in the realm of DEBVs and getting that shift work, that 4 to 6 hours here and there, we have been really successful in Los Angeles in opening it up to local volunteers and doing local staffing using that tool, so that the minute that you get a DRO number, you can set up the DRO shift tool. You do not have to wait on the portal to open. It's not connected to the portal. It's connected to the DRO.
Thank you, Marcus. I don't see any other questions in the chat and no hands raised.
Awesome. So now is the time, the DEBV shift tool, it does so much stuff for you. It does automatic COVID screenings. It has terms and conditions on the different type of workers and shifts you're requesting. It is just one of the most robust tools you can ever use on a DRO when it comes to putting people on shifts. I am going to just pause here for just a minute, Janella, and by pause, open it up for people to maybe ask me questions or pick my brain a little bit on maybe I didn't cover something that they have a burning question on in the first 24 to 48 hours.
Okay, so you can raise your hand, of course, and we can call on you. Or you can unmute your mic and go ahead and ask your question. All right, we have a question from Laura Dugan. Laura, you want to ask your
question? Yeah. So Marcus, maybe you were going to go over this later. How do you get a Google phone number for? I know if you, for a staff services phone, you go through DST, but I remember someone saying that you were able to request a Google phone number that was specifically used for staffing, and there was a certain way to set up a voicemail on it, and I was just curious about that.
Yeah, I can absolutely wonderfully answer that. I think my volunteer partner who is lurking on the call is probably even more the expert than I am, but we do use Google Voice. A lot of regions have been through consolidation, phones being taken away, hotlines no longer available. So we actually created a Google account, and I think it's something like ARCLA.DWE. ARCLA stands for American Red Cross Los Angeles. And we set up a Gmail account. And from that Gmail account, we're able to set up request a Google Voice number. And that Google Voice number does have to be tied to a specific phone when you first open it. Google Voice is designed around being a forwarding type number. It's not really a hotline or a call center or anything like that. But so you do have to tie that first initial number to it. We used one of our phones in the EOC, and from there we were able to set up the Google Voice number, and then you can add people into it. So we have our entire deployment and staffing team added into it, and we can turn them on and off based on who's available or who's on call. And when we do local operations, we do the same thing. We use the staffing hotline, and from there, it's whoever's assigned to the staffing team and working that event. We turn it on. We turn those people on or off. I do see that Richard is offering to do a little more in depth on the Google Voice stuff. I'm also, if you'd like to set up with Richard, who's my volunteer partner, Richard Ma, or myself, additional time on Google Voice, I'm happy to share that. I'm happy to show you how we use it and what we think about in strategy for using it. Because it also does texting. That's the one thing that I love. You can do a shared text message thread with your team, and anybody on your team can then respond to that Google Voice text. So if they text you back, yes, you're available, yes, they're available, Laura, then anyone on your team can go into that account, log into it, see that text message came in, and then start getting to work assigning them.
Awesome, thank you. And Richard, I am absolutely going to take you up on your offer.
Okay, Jane, did you want to come offline and ask your question, or unmute your mic and ask your question?
Sure, no problem. I've heard a variety of different answers to my question, so I want to clarify what you said. That on the backdated entry, you can backdate someone past the beginning date of the DR back to the original 24 or 48 hours.
So Jane, my understanding is yes. You can backdate them yes, you can backdate them prior to when the DR number was issued. Backdated entry is not predicated on the issuance of the DR number and that specific date. That is my understanding of it, Jane. We've used it to some success. I'm trying to tread very lightly there, Jane.
I can tell. I happen to be one of those that monitors disaster.staffing. I've been trying to get a written instruction about this, but I just wondered if you had anything clear.
The answer to your question is no. There's really not any good documentation on it. There's not a good job tool on it. It's something that we have, and you knowing working in the national staffing team, you've seen it. We've created our own stuff. There's not really a good national document or true clear guidance on it. It's all kind of been passed from person to person.
I'll keep pushing for that.
Hey, if you want me to sign on to your bandwagon, Jane, I will totally be on that bandwagon with you.
Hey Marcus, I'm just sharing a document that Luhan are creating how to use a Google Voice on the DR. We did all three together, and I share that on the chat.
Oh yeah, that's perfect, Veronique. Absolutely, that's a good document to reference. That we used on that DRO that you and Luann put it all together. Yeah.
It fell, unfortunately, so I don't know why. Let me try to redo it again.
Yeah, that's a good that's a good place for folks interested in Google Voice. It's a great tool for you guys to use. I use it on almost every DR that I go on, and we use it locally. So awesome. Any other questions?
Marcus, this is Luann. Back to the backdated entry conversation. It's also my understanding, or at least from my experience, is that you have to wait like 3 days. There's like you can't go in like the day after the person out processed, or like what we've done. If we've had like the DAT team, went out on the call, they were the first people to open up a shelter. They did some logistics runs. They kind of worked for a couple of days before we got a team set up. They're the ones that sometimes will go back in after the fact and do a backdated entry, or, but you have to wait until it's 3 days after they've finished doing, either been out processed or done what they've done, their work they've done.
Yeah, Luann, I think that's probably accurate. I have noticed that you can't do it immediately. I don't know that 3 days is the exact written in stone number. I think that's probably accurate, which also why you want to think about it and start making notes and keeping up with it when you're opening a DRO and what you need to do, because you're not going to be able to do it immediately. You may not even be the team that's doing it. They have to have been checked into the DR. They have to have been checked out of the DR. And then you can do the back data entry. And I think you're right. Like a lot of things in Volunteer Connection, there is a little bit of a delay. Just like another thing to bring up, Luann, is the fact that a lot of people on the DRO shift tool that we talked about, a lot of people might try and do shifts while they're assigned to the DR. They'll assign everyone and then they'll try to put them in on shifts. If you're assigned to a shift in the DR, or if you're assigned to the DR, then you won't see the shifts in Volunteer Connection for the DRO shift tool. It prevents you from doing the same. You can't assign someone and have them work a shift. Volunteer Connection always takes a little bit to catch up with us. Some things it happens right away, immediately. Most things it's an overnight refresh.
Okay, I don't see any more hands or questions.
All right. Any other questions? Now's the time to pick my brain. And use and abuse me, as they say.
Laura?
So Marcus, what is your recommendation as far as staffing your staffing team? Like how many people would you normally start off with?
Good question, Laura. Generally speaking, for us in our region, we work really heavily on that local community volunteer model, doing shift work and not as much assignment. So I normally start with a lead, and then I start with no less than 2 people on my team. One primarily focusing on the SPS or staff planning and support side, and one focusing on the local community volunteer side. I would suggest, depending on your region, you assess, are you going to be bringing people in? Are you going to be assigning people for 2 weeks? And then assess, you probably might want to add one more. So I shoot for no less than 3 people on the team when starting up the team. And then as the operation grows, expand. The LCV model in our region can get very complicated and very intricate very quickly. So we have a tendency to expand that a lot quicker than we have the tendency to expand the staff planning and support side. We have a lot less people that we're going to be checking in and out of an operation. So normally I keep that up up until a 3-ish, I keep it to one or so person on the SPS side and 2 on the LCV side.
Brett, did you want to come off? I'm sorry. Did you want to unmute your mic and ask your question?
Sure, I know it depends on any number of situations and what roles everybody gets placed in, but what would be the ideal pie in the sky relationship with DPMs at this time in the DRO?
Brett, you loaded question. Did I see the bus pass me over? No.
Oops.
The preferred relationship would be that you have one prior to it, right? DPMs are the individuals that have the relationships locally with their volunteers, hopefully, and locally with their EM and government and community partners, and are literally a Swiss Army knife that they're expected to do everything. And so hopefully you're communicating, Britt, with them. You should be ensuring that it's part of what I was talking about, and every region is different at the beginning, and using your communication tools available. You should be pushing to them what the needs are across your region. You should be having that conversation with them about who's available, or frankly, really what's probably more important is who's not available, who is required in that territory to cover their DAC coverage outside of this DRO. That's a really important conversation to have. We call it the no-fly list in Los Angeles. These 4 responders across our region, I don't care what else is going on, do not pull them to the DRO, because they're covering our DAT and they're ensuring that those things are happening. So at least the conversation about maybe that no-fly list and making sure that they understand what the needs are. Hopefully, Britt, in Blue Sky, your RDO and team are updating them to that. It's not necessarily the onus of the staff services team assigned to the DRO. That should be a conversation that is being had with the DWE manager, the RDO, and the DPX team. Did I answer that without completely jumping in front of the bus?
Yeah, we don't have a DWE. We've had and haven't had one for a while, but yeah, I was thinking those are all great things, and we're a pretty tight communicative team, so I think we're all on the same page.
Oh, Britt, are you in Alaska?
Yeah.
Britt, Richard and I are happy to talk to you about it a little bit more if you want to talk strategy on that, and think through some of that. I know Kathy Wolf has been supporting your region while you've not had a DWE manager remotely. If you want to talk strategy on how thinking about those relationships ahead of time or something like that, Richard and I are very happy to have that conversation with you, Britt.
Okay. Thank you.
Okay, so do we have any other questions? I don't see any in the chat.
So, but I guess the point.
Awesome. Well, Janella, thank you, Janella and Susan, who is on vacation, which she rarely ever takes, and Sherry for organizing this series. I am so happy to be a part of it. I will also offer out to all of this team that anyone in staffing, if you are deployed to an event or you have a local event, While I'm not promising to work the event for you, if you have questions or have thoughts and want to pick mine or Richard or my team's brain, don't hesitate to reach out to me. I am more than willing to be a phone-a-friend for you. I only know what I know because I asked a lot of questions the first time I was assigned in staff services. And Sandy Archer was the most amazing person I've ever met and did not tell me just how stupid I sounded when I would ask the questions. So please don't hesitate to call me.
Okay, thank you.
Thank you, Marcus, for a wonderful presentation. That was excellent. Okay, ladies and gentlemen, that's the end of our session. If you have any other announcements or anything that you want to make, any questions you want to ask in regards to the staff services competence builder, please go ahead. We still have Cherie on the line with us, Cherie Lewis. She's been doing an excellent job in emailing out the recordings to us, and so I do appreciate that. But if there's nothing else, again, we thank Marcus, and we'll see everyone next Thursday.
Thank you, everyone. I'll send out a recording of this session following it this afternoon. Have a great day.
Great job, Marcus. Thank you.
Thanks, Janella. I'm always happy to work with you anytime.
It was great. Are you going, you know what, I probably should have asked this while we had everybody on the line. Are you going to be able to attach your presentation to the chat so we have something to refer back to?
Yeah, I'll be happy to do that. Absolutely.
That would be great. Yes. And then we have the recording, and of course we have the transcript, and that'll help too.
Yep, not a problem. And
Right.
I'll try and also attach the monitoring document that we use in our region for DEBV activation and intake monitoring.
That was something that was requested by several people. That would be great.
Yep, absolutely.
We in San Bernardino certainly would like to use it.
Yeah, no problem, Janella. It's a labor of love, so I'll put it in there, and get that from my VS team today because I have a meeting with them in basically 3 minutes.
Okay. All righty. Thank you. Thanks, everyone.
Thanks, Marcus.